Hello and good evening, Dr. Suresh. Welcome.
Hello, Shmitsu.
So in this season, we are very happy to have you here with us. Before we are diving into our first topic, which is a topic for chiropractic care for kids, we would like to know a little bit about you. Like, how long have you been in Cambodia, and how's life become a chiropractic in Cambodia?
So I was graduated in France in 2007. So I used to work for 14 years over there. Then I moved to Mexico, and then finally after 2 years I came here in Cambodia. So I'm here since like 1 year and a half now, working at ICC.
It's very nice to have you here with us as well in ICC. Well, without any further delay, we would like to start our topic as a chiropractic care for kids. So what is usually the main problem that the kids have, and for you? Yes.
Okay, so depending on the age, so usually when you talk about the kids, it's around 4 or 5 years till 15 to 16. At this age, usually we see a lot of scoliosis. So usually the main issue is the curve of the spine of the kids. Usually the parents are concerned because it's a genetic issue. So if the kids have it, meaning it's coming from the parents. So we have also something, we have to check both with the parents and the kids. The parents doesn't want the kids to have the same issue like lower back pain as they used to have. So that's why they come for the prevention for the kids.
So with the prevention, as I'm really curious, is that how old is the kid to be able to start to come to get like checked up from the chiropractor? So
they can check them basically from birth. Usually I used to receive just after delivery for the mom, the parents. We can see already after the birth that they have a slight curve. At this age, we don't really work on the scoliosis because they are just just newborns. So we have to wait a little bit. At this age, we're going to check more tension on the skull, or if there's any flat head or something like this. Usually it's more around 5 years that we start to see the kids, like, they start to get some pains on the lower back, because when they go to school, the backpack are heavy. So parents are saying, my kids, he has pain on the lower back. So at that time, we start to see the kids around 4 years.
I see. So beside the scoliosis, what is the other main point that the parents have to be main problem that the parents need to be aware of and taking care of for when they was younger?
Kids means also for a lot of them sports activity. So they got also a lot of sprains, like ankle sprain. Can be a knee also sprain. A lot of boys, for sure, they are playing soccer, so they got a lot of issue. After that, depending on the sports, like if it's a jumping sport like basketball or volleyball, there's a lot of issue in the joints. So not only scoliosis, but basically all the joints issue, knees, ankle, wrist, all this kind of stuff. So we can cover all these things of pathology.
I understand. With the chiropractic treatment for the kid, is it very different from the adult, or what kind of technique that you use to treat them?
For sure, it's not the same strength that we put on the patients, but we use quite the same tools and the same also the adults as the kids. They have some physiotherapy, for example. If they have some curve due to the scoliosis, we can work with the physiotherapy with special electrotherapy in that case. So basically, yes, quite the same, just we adapt the force for the patient.
So, Doctor, I want to ask one more thing, is there, because for now we see that a lot of kids having pain younger and younger, right? Is there any advice that you could give to the parents or to the kids?
The most important things, I guess, and we used to say a lot when we receive the patient here at the clinic, it's probably due to the cell phone. So not getting too much curve with this position. Usually we ask them to get the position more in the front of the face. So we try to, as I know it's difficult for the parents, So we try to ask them to not put too much the kids on the cell phone or the tabs or something like this,
Right.
because the posture is not good. So I would recommend to be careful about the posture, but I'm a dad, so I also know how difficult it is to give the advice, the recommendation. Usually the kids are pretty stubborn.
I see.
So we try, to recommend this for the patient, and also, just adapt the activity based on depending on the condition of the patients or the kids, and we would probably recommend a different activity if they have a different issue on the spine.
អញ្ចឹងអ្នកទាំងអស់គ្នានៅពេលនេះគឺយើងបានបញ្ចប់នៅភាគ1របស់យើងចាដែលនិយាយអំពីការទប់ស្កាត់នៃការឈឺចុកចាប់ផ្សេងៗសកម្មភាពនិងលំហាត់ប្រាណផ្សេងៗសម្រាប់កុមារចាដោយសារតែកុមារឥឡូវហ្នឹងគឺចាប់ផ្ដើមមានបញ្ហាច្រើនជាងមុនអញ្ចឹងណាមានដូចជាការវិចអង្គខ្នងចាការឈឺជើងការរងរបួសអីផ្សេងចាអញ្ចឹងចំពោះយោបល់និងដំបូន្មានរបស់ដុកទ័របំបញ្ញមិញខ្ញុំគិតថាគឺសុទ្ធសឹងតែមានអត្ថប្រយោជន៍ច្រើនចំពោះប៉ាម៉ាក់ថ្មីថ្មោងឬក៏ចំពោះក្មេងៗផងដែរចាខ្ញុំក៏សូមអរគុណដល់ទស្សនិកជនរបស់យើងទាំងអស់គ្នាដែលបានតាមដានភាគ1របស់យើងចាពីដើមរហូតមកដល់ចប់ហើយក៏សូមកុំភ្លេចថានៅក្នុងរដូវកាលទី3នេះគឺដូចជាមួយនឹងរដូវកាលមុនផងដែរចាដែលយើងមានដូចជាការឆ្លើយសំណួរប្រចាំសប្តាហ៍ដើម្បីឈ្នះនៅកែវទឹក ICC របស់យើងកុំភ្លេចចូលរួមទាំងអស់គ្នាណាហើយជួបគ្នានៅអាទិត្យក្រោយនៅក្នុងចាប្រធានបទផ្សេងទៀតសូមអរគុណ